If you are taking Levodopa orally, in other words, if you are taking Sinemet, Rytary, or the new medication Crexont, this video is for you. We will discuss about the most common side effect that you need to know if you are taking this medication. My name is Dr. Zayas. I'm a neurologist specializing in Parkinson's disease and other movement disorders. The first thing I have to tell you is that this video is not against Levodopa. Actually, there is nothing better than Levodopa in 2025 to treat Parkinson's disease. If you know something different, let me know in the comments. These are the 6 most common side effects of Levodopa. When I say Levodopa, remember, I am talking about Sinemet, Rytary, and Crexont. Crexont is a new medication approved by FDA last year. It's a long-acting medication. I will talk about this medication in another video. Let's start with the most common side effect of Levodopa, which is, number 1, nausea. Feeling sick, feeling nauseated. Usually happen during the beginning when you start the medication. That happens in approximately 20% of the patient. I have a full video about what to do, how to manage this problem. The link of the video will be the description of this one. Side effect number 2, orthostatic hypotension. What is that? That means that when you stand up, the blood pressure drops and you will feel dizzy, lightheadedness. So I have a full video about how to manage this condition. The link will be in the description below as well. Number 3, and is exacerbation of psychosis. When I say psychosis, I mean hallucinations, usually visual hallucination, but not always, and also delusions. That's another problem that might happen, might not. Remember, this is side effect that might happen to you, but that doesn't mean that it's gonna happen. You just need to be aware of this potential side effect or effect, whatever you want to call it. Number 4 are dyskinesias. What are dyskinesias? Dyskinesia are dancing-like movement, abnormal movement. That happen when you have Parkinson's disease and you are taking Levodopa for years. Usually 40% of the patient after 4 to 5 years taking Levodopa will develop dyskinesias. The majority of the time are mild and that doesn't bother the patient. Okay, I have a full video. The link will be below, again, describing how you manage this problem. Number 5, exacerbation of daytime sleepiness. Normally, many patients with Parkinson's disease automatically, it's part of the package. They have daytime sleepiness. But when you take too much, especially if you take too much at once, so individual dose, high doses, Levodopa might make you sleepy. Number 6, and the last one we are going to talk is impulse control disorder, such as pathological gambling, hypersexuality, eating too much. All of these things are rare, happen in less than 5% of the cases, but it might happen, so you need to be aware. Just to summarize, to wrap things up, there is nothing better than Levodopa in 2025. The only thing that might come close is having a good routine of high intensity exercises, but you still need to take Levodopa in the majority of the cases. The other thing I have to be clear so you understand that Levodopa is not toxic. Okay, Levodopa is not toxic and you should not be afraid of taking this medication if you have Parkinson's disease. So make sure that you have the correct diagnosis first, right? If I have Parkinson's disease, Levodopa is the medication I would be taking in any formulation, it doesn't matter. Plus, having a high intensity exercise program like I'm doing right now. I'm training for a 5K in April, so I'm doing a high intensity exercise program. And let's see what happens. If you like this video, don't forget to subscribe to my channel. See you soon.